Hello everyone, I'm Marissa and today I'm going to talk to you about cystic fibrosis. This is the disorder I have been researching since the beginning of the semester, so I have a lot to tell you about it. What is cystic fibrosis? Cystic fibrosis is caused by a mutated gene and it commonly causes buildup of thick and sticky mucus, progressive damage to the respiratory system, and infection in the lungs. So all of this kind of ties together because of the thick and sticky mucus causes a lot of respiratory issues as well as lung issues. Issues in the liver, long-term digestive system problems, pancreatic damage, and CF-related diabetes. So all of these things also tie together. When there's pancreatic damage, there's less digestive enzymes in the pancreas, which causes digestive system problems like underweight, malnutrition, diarrhea, and whatnot. CF-related diabetes is because the pancreas cannot create enough insulin for the body, which causes diabetes. And then infertility in men and pregnancy issues in women, and salty tasting skin. And then here on the right, I have a picture that shows you healthy lungs and airways with healthy mucus in correlation with lungs affected with CF and airways with CF mucus. So you can tell that they're a lot more clogged. The prevalence of CF. So CF is more prevalent in newborn Caucasians than any other population. You can see this in the chart down here. There's one in about 2,500 Caucasian newborns that will have cystic fibrosis. There's approximately 1,000 new cases a year in the US, and males and females are equally affected by CF, so it doesn't prefer a single sex. And it's the second most common life-shortening inherited disorder, right behind sickle cell anemia. So the life expectancy, based on 2018 registry data, which was the last data published, if you were born between 2014 and 2018, you're estimated to live around 44 years old. And if you're born in 2018, then 50% of people with CF are expected to live around 47. You can't really make an estimate because everyone is different and everyone has their own individual characteristics with CF. So 86% of CF individuals have at least one additional complication, which comes from having CF. So the people who don't have additional complications have a better chance of, having a better quality of life and living longer than others. It also depends on severity of the mutation because disease progression obviously is worse when there's a more severe mutation present. So the molecular cause. CF is caused by a mutated CFTR gene on chromosome 7. So the most common mutation to the CFTR gene is the F508 delta. So this specific mutation accounts for about 70% of all CF, and then 50% of people who have CF have two of these mutations, one from the mother and one from the father. So the normal function of the CFTR protein. It acts as a chloride channel in epithelial tissues to regulate water and ion secretion and absorption. In simpler terms, it basically acts as a gate that opens and closes to let the chloride ions from outside of the cell inside of the cell, which you can see in this little picture here. And there is a thin layer of mucus normally present in the body, but in CF it's much more clogged up. So when the CFTR protein is mutated, it is either not fully functional or functional at all. It is not built properly or the 3D shape is not formed, which is essential to the function. So when it is mutated, the function of it is the salt and water homeostasis is off, the mucus is dehydrated, there's an abundance of salt in the sweat, which goes along with the salty tasting skin that I mentioned earlier in the symptoms, and the sodium ions cannot cross the cell membrane correctly. And this picture really depicts that great because you can see that all the sodium ions are, there's like a lot inside the cell, but they can't get outside of the cell because of that large layer of mucus blocking them. So the gate isn't open. And up here, you can see how much mucus is clogging that airway. So mode of inheritance. It's autosomal recessive disorder, like I had said earlier, and an individual will have two copies of the CFTR mutated gene in order to have cystic fibrosis, so one from each parent. So if each parent is healthy and unaffected by CF, then they are both carriers for the disease and have to give one of each of their mutated CFTR genes to their offspring. in order for their offspring to have cystic fibrosis. Down here I just have some kind of like Punnett squares, but written out. If one parent has CF and one is not a carrier, then 100% of the children will be a carrier and none will have CF. And then if one parent has CF and one parent is a carrier, 50% will be a carrier and 50% will have CF. If both parents have CF, then 100% of their children will have CF because both of them will have that recessive, the dominant recessive, you know. This is just a nice visual representation of that. You can see that the shaded mean that there is either cystic fibrosis fully present, which would be this, or half shaded would mean that there's a carrier. So here, 50% of the children would be carriers, and one would have CF if both parents were carriers. This is just probabilities. This is my pedigree that I created earlier in the semester. The yellow denotes the people who have cystic fibrosis, and as you can see, many of them over 40 years of age have passed away, and that's because of the life expectancy. And you can see the autosomal recessive trend of this pedigree. So on to genetic testing for cystic fibrosis. So the most early genetic testing you can do for CF is prenatal genetic testing, and two of the most common ways used today are amniocentesis and chorionic villi sampling. And basically they just get DNA from the placenta using two different kinds of methods to test for cystic fibrosis. The most common, and just because it is actually mandatory by all 50 states, is newborn screening for cystic fibrosis. So like all other newborn screening, blood samples are retrieved from the heel and put onto a Guthrie card and then tested for either IRT solely or just IRT DNA levels, depending on what the state requires. And then, yeah, it's tested for cystic fibrosis. And then 1 out of 35 genetic disorders on the recommended uniform screening panel for newborns, which most states use kind of as their baseline for what they require for screening. A sweat test is what rules out if CF is positive for sure. So sometimes, of course, with genetic testing, you can get a false positive result, and this will rule out if it was a false positive or if the child really has CF. And it's a very simple test. As you can see on the right, this is how they do it. They just put a little square on the child's arm to test. And as I said earlier, there's more of a salt concentration in the sweat of someone who has cystic fibrosis. So in the chart here, you can see that the more sweat, then it indicates cystic fibrosis. And these are my references, so I hope you enjoyed my presentation. Thank you for listening.